And at this point, I feel...
At the health stakeholders meeting that was held here in Nairobi, that brought together health workers and union officials of the health docket, the health officials spoke with one voice, saying that the government should involve them in the leadership roles, pointing fingers to politicians for neglecting the challenges facing health sector despite it being tabled in Parliament.
It is only in Parliament, Your Excellency, where we can make the right policies, the right laws, which can be able to work for our healthcare systems in this country. But what we see in Parliament many a times, it doesn't seem like those parliamentarians really have seen these patients suffering. And that is why when a bill is brought in Parliament touching on health issues, it is not given the right timings, it delays. And the Speaker who has spoken here about NHIF has literally said that there are several amendments that are still lying in Parliament.
According to the Secretary General, Kenya National Union of Nurses, Seth Panyako, the major challenge facing nurses is delay in payment of salary, and therefore he advocated for a centralized system of payment of salary to health workers.
If you give me a centralized system of payment of salary, a centralized system of allowing county governments to give out the specs on the employees they want, you, County A, give us the specs as the health system, as the whatever it is, the workers you want, pay, employ them. Once you employ these workers, offload them into that system. Even if you have the Health Service Commission, as we have been saying before, of which, if we can get our salaries on time, statutory deductions can be paid on time, and there's a system where health workers can work across the country seamlessly.
On his part, Deputy President William Ruto pointed out that they will focus in the health sector of the country, noting that the health docket will be empowered so as to boost and change the narrative of the health digital system.
So if we must figure out how we are going to start at the bottom, how the health center, how the dispensary, how the community health worker is going to be empowered sufficiently to be able to deal with the challenge right at the root. If there is one thing we must figure out from where I sit, you will tell us better. If there is one thing we must sort out, is we must take health to the bottom of the pyramid.
Reporting for Ibru TV, my name is Winnie Maganga.
In the midst of a pandemic, she is well taken care of.